The COVID-19 pandemic has significantly impacted Indonesia, both in terms of health impacts and socio-economic effects. Poverty has increased, people's purchasing power has diminished, thus threatening household food security. Adding to the situation, the national stunting prevalence stands at 27.67% BPS 2019, and 70 districts and municipalities are vulnerable to chronic food insecurity FSVA 2020. Also, the deterioration in dietary quality and calorie intake due to pandemic impact will put at risk children's growth and development. Under the United Nations, COVID-19's response to Multi-Partner Trust Fund joined the program, the World Food Program, initiated to provide technical support to Food Security Agency and the Statistics Indonesia to monitor change in food security trends and assess the impact of the household's food security and livelihoods, particularly in remote areas which are at risk of being left behind and difficult to access. The monitoring system, called Mobile Vulnerability Analysis and Mapping (MVAM), which has been applied in 30 countries globally. MVAM can capture and analyze, first, who is food insecure or vulnerable. Second, how many are there? Third, where they live. Fourth, why are they food insecure or vulnerable? Fifth, what can be done to save their lives and livelihoods? And sixth, how is the situation likely to evolve and what are the risks threatening them? MVAM could facilitate regular data collection through phone surveys, including computer-assisted telephone interviews, CATI live calls, short message service, interactive voice response system, or web surveys. Or in other words, MVAM can assist the government partners in 3 areas. 1. Monitor food security information in a near real-time manner, especially for remote areas. 2. Giving on-time analysis that can trigger further required analysis. 3. Inform a more effective and structured response and operating program for a more sound decision-making. Before deploying MVAM in full-scale utilization in the future is an initiative, the Vulnerability Analysis and Mapping (VAM) unit of WFP Indonesia Country Office (CO) conduct a feasibility study on MVAM from November 2020 to January 2021 in Papua and West Papua Province. Both provinces are among the most remote areas in Indonesia, particularly vulnerable to food insecurity and malnutrition, since its Food Security Index, or FSI, stands at the lowest among other provinces. The study perceived MVAM to be feasibly deployed in eastern parts of Indonesia with certain premises. One of them is to shift the in-person data collection toward remote approaches to obtain fast, frequent, and more reliable data. Moving forward, it is important to enhance strategic partnerships and innovative collaboration models with government partners and other relevant stakeholders. Also, to exercise the pilot study of identifying needs, testing different modes, detecting the early symptoms of the difficulties, and knowing the best practice to devise strategies in overcoming problems. Let's move forward to ensure food security in Indonesia.